thank you everybody for being here. We tried to make a great day for you. We got a little bit of cloud, but not much. So hopefully you'll enjoy the rest of the day. So today's an exciting day for Spokane County. Today we kick off the construction of our new mental health crisis stabilization facility. This is the first of its kind in the state and is transformative for the criminal justice system for Spokane County. We've been working for over 3 years to put this project together. And when I say we, that is the big collective we, from state to local jurisdictions, to the hospitals, to nonprofits. This has been a community effort to try and get this facility, which really speaks to the fact that it is an important asset for this community. I want to start today by recognizing some of the elected officials that are here, including many of the speakers. Josh Kearns, County Commissioner Mary Cuny, Mayor Nadine Woodward, Council President Brian Biggs, Mr. Ellis, representing the Sheriff, who unfortunately wasn't able to join us this morning. As mentioned earlier, this facility is the first of its kind in the state of Washington, and it combines in a single location pre-booking, jail diversion, mental health crisis stabilization facilities, withdrawal management services including detox, holdover beds, and medically appropriated environment for peer support services. One of its kind in the state of Washington. By reducing the number of stops an individual in crisis must encounter, start them way on the path of recovery and stabilization and into long-term life enhancements, this facility will facilitate that process. As a pre-booking diversion option, individuals remain eligible for Medicaid paid treatment and services as opposed to Spokane County taxpayers. So it's a big win for our taxpayers on the local level. We'll be able to keep these services paid for by the federal government. This facility is designed to be used in combination with crisis intervention training by officers in cooperation with co-deployed teams of mental health professionals and officers in the Regional Health Behavior Unit. That unit has done an incredible job at helping our folks that are challenged by mental health crises out on the street. And by having that trained professional as a ride-along with the either city or county law enforcement officers, they've been able to provide that immediate diversion as opposed to having to have people enter into the criminal justice system. This facility allows individuals to have life restarts without increasing criminal recidivization in the jail. Often it takes a few times for us as humans to make long-lasting changes, but this facility offers the opportunity outside the criminal justice system for eligible individuals without increased risk and build in safeguards to the community at large. This facility will include racial and ethnic demographics as part of the outcome metrics. Intake information will be designed with involvement from ethnic groups to ensure staff is aware of unique needs that may be present for different populations in our community. That's the basic background for what this facility does. I'm going to now introduce my fellow commissioner, Commissioner Josh Kearns, that will also have some comments, and each speaker will introduce the subsequent speaker, and then I'll close out the comments. So again, thank you everybody. Commissioner Kearns.
Thank you. I'm your County Commissioner, Josh Kearns. First of all, I want to thank everyone for being here today. This building represents an incredible asset for this community, and to have so many people from our community here with us today just drives home that fact. This building will provide folks an opportunity to get help when they are in crisis. I mean, just that if we just take a minute and think about what that means. The huge number of folks that are involved in our criminal justice system, that are justice involved, that are dealing or battling with mental illness or some form of a mental health crisis, the numbers are huge. This right here behind us, this is one of the parts to solving that problem. It's not the only thing that's going to do it. It's not going to be that silver bullet, but this will make a huge difference for so many people in our community. I want to take a minute and say thank you to some of the people that have spent hours and hours and hours in meetings with us commissioners. I want to recognize Dan Ziegler and say thank you for your hard work, for Kirsten Gable for her hard work, and especially Arian Schmidt for everything she's done to make this a reality. This has been years in the making, so that this is a day that really puts a smile on my face, because there's so much work that has gone into this facility, and today is where it starts to become a reality. And also want to give a shout out to Baker Construction and Development. They're going to build us a beautiful facility here that, again, is just going to be a tremendous asset for this entire community. Thank you very much. And next up, I will introduce County Commissioner Mary Cuney.
Well, you can tell we didn't coordinate our speeches, because a lot of what Josh said is how I feel as well. So, I mean, a big shout out to Baker Construction, because they're going to build this and get this done by the end of June, which is a very tight time frame. And so thank you for stepping up and being willing to do that and help us get there. And to Pioneer Human Services, because having you operate this facility is so important, and you've been a partner all along the way. So thank you as well. We do see this since I became commissioner October of 2017. This has been a topic, and we have been working on it since then, trying to make sure that we get the financials right, so we know how the costs are going to go, so that way we're not putting a burden on our taxpayers. But what this truly does is it's for the individuals that we get to divert them from our criminal justice system and get them the help that they need. Because currently, right now, if you're in crisis, if the police pick you up, you either end up at the ER, or you end up in our jail. And we don't want that to happen, because that's not really where they need to be. And so having this opportunity to be able to divert them into this facility is going to be key for those people to get the help that they need and to help our citizens. Thank you. And now I'll introduce Mayor Woodward.
Well, thank you. First, let me say that it's a real honor to join all of our regional partners this morning for a groundbreaking of this facility that will provide a real vital service for our community. A lot of work has gone on over the last several years into making this project a reality. Most of it, of course, predates my time in office, but I am thrilled, and as city is as well, to be a part of all of this. I'd like to give special acknowledgement, though, and congratulations to our county commissioners, to our police chief and sheriff who couldn't be here, to our council president, Brian Baggs, and to Pioneer Human Services for the collaborative effort that it took to get us where we are today. A couple of things make me excited about this mental health crisis stabilization facility. First, it gives much needed capacity to offer care for people in need in an environment that helps strengthen our communities throughout our region. To be able to offer treatment close to the support of family and friends increases the chances for successful outcomes. Second, this facility provides much needed substance abuse and mental health treatment for patients who would otherwise wind up in jail or in an emergency room. The need to treat drug addiction and mental health disorders has spawned services like the Behavioral Health Unit, a joint program with the Spokane Police Department, the Sheriff's Office, the Valley Police Department, and Frontier Behavioral Health. This behavioral health facility provides another tool in our system for those who meet the criteria for accessing resources. It is an important extension of the options available to our behavioral health unit officers and also mental health professional partners. And what makes it unique is that it offers all of the much needed services co-located in one facility to provide a better service to our community and a better chance for individuals to get the help that they need to re-enter our community. The most authentic thing about us as people is our capacity to overcome, to endure, to transform, to love, and to be greater than our own suffering. And that's just what this facility helps people discover in themselves and comes alongside of them to help them in their greatest time of need. So we should be extremely happy in our community to embrace and celebrate a facility like this. Thank you. And now, Council President Bream Beggs.
Thank you, Mayor and Commissioners. I have to say I've gone to a lot of groundbreakings in my almost 5 years on the City Council. This is by far the most exciting one that I've been to. It is revolutionary not only in the substance, but in the process of how we got here. A few of us 6 or 7 years ago were imagining something like this, but it is not enough to have a good idea. How do you build support and bring a community together? And this is a great example. And to me, when this really took off was when the detention services staff, especially Christy Ray and Mike Sparber, said, we have 60% of our inmates in the jail have a serious mental health issue. And the jail is probably the least effective place to try to treat those people. And also, as it turns out, then when they're in the jail, they're not eligible for Medicaid funding, which means we as local taxpayers have to pay. And they pushed that process forward, and they reached out and they made partnerships with the Spokane Alliance, which is a group of churches and labor unions that try to get good government done. And they reached out to Fuse, which is a grassroots group that tries to get momentum for good public policy. And they reached out to the commissioners, and they reached out to the city council, and everyone was working together and putting together plans. And the thing that was amazing is that, I came back in 2004 to Spokane, and the jail, which is just over there, has kind of loomed over us of a problem and a frustration that we can't figure out. We all want less crime. We all want accountability. We all want less taxes. But we've had a really difficult time figuring out solutions for what's going on. This became part of the solution. And it started out, again, lots of committee meetings. We didn't feel like we were getting anywhere, but in a rare collaboration at the time, not so much anymore, but the city council directed their lobbyists to try to get a grant for the county to be the first funding for this. And then the county took the baton and got more funding. And then the city and the county have dedicated more money. But the great thing is instead of hundreds of millions of dollars for a partial solution, it's under $10 million, if I understand correctly, in the latest bid. And what it's going to do is this. When people can come here just for a few days, they can get stabilized. And they don't have to go to the jail, which costs us a lot of money. The average person with a mental health issue at the jail spends well over 20 days at the jail, at hundreds of dollars a day, $135 a day there. And they also tend to recycle back in and out, back in and out. Facilities like this in other places keep people out of jail over the long term. And what's unique about ours is we're combining not just the crisis intervention at the moment, but we're combining sobering and we're combining diversion, which when people are waiting for a treatment bed, they're ready to go. Right now, they're out on the street and the chance of relapse is so high. This stabilizes them. So we're super excited, and Medicaid is going to pay for almost all the operating costs. Not all of them, but close. Whereas at the jail, we are paying for it. So it's really going to be a game changer for us, and not just in the process of how we got there and working together, but also the substance of it. And so I can see going forward really a solution to the overcrowding problem that we have in the jail. Right now, I think they tell us over 60% of the jail inmates have a mental health substance abuse problem. 70% of the people in the jail are there pre-trial, which means they haven't been convicted, but we don't trust them to come back to court, or it's unsafe to have them out there. This is not going to take care of the several hundred people all at one time. But what it will do is take care of 45 people at one time. And it will get them in a situation where they're unlikely to come back. And we can whittle down those numbers, and we can do it in a way that feels safe. The other thing about this that I'm really excited, if I could leave you with anything, it would be this. The reason this works is that our community is often divided of how we deal with crime. We know the same results we want, but how to get there. The great thing about this is the first people who have a say in who comes into this are our prosecutors, our elected prosecutor's office. They decide what charges people are eligible, if they're charged with, to come here. So they've made the first cut on that. But the next person who decides is a law enforcement officer. They decide, I picked this person up. I believe they've committed a crime. I could take them to jail. But you know what? I think they would work better here. And the community would be safe if they came here. Maybe even safer than if I took them to the jail. So law enforcement and public safety makes a call. And then the person, the individual, they have to agree to come. So it covers all the bases. And that is what's different about this. And that's why it is a way forward. And I do just want to commend all the people who have worked together on this to get us to this place. It is the way forward. And your community, you deserve to have us doing this kind of innovative work that will save money, reduce crime, and rehabilitate lives. Thank you so much. And I'd like to bring in a great law enforcement officer, Dave Ellis, who is Police Chief of Spokane Valley and Undersheriff of Spokane County.
Well, good morning. Thank you for coming out for this groundbreaking ceremony here at the Mental Health Crisis Stabilization Facility. This project is an advancement of some of the mental health efforts conducted by law enforcement regionally in partnership with the Spokane Police Department, Spokane County Sheriff's Office, Spokane Valley Police Department. A little bit of an overview of some of the programs that we've done that this is going to build upon is our Behavioral Health Unit, which is a co-responder team made up of officers and deputies locally, paired with mental health clinicians from Frontier Behavioral Health. These units are out in the field. They're dealing with people on their worst days when they're having mental health crises. They help to de-escalate the situation. They try to work to keep them out of the criminal justice system, find them the resources that they need to be able to get their lives put back together. This project here is the next step for that. This will allow us to address those problems that we can't address directly out in the field. We can bring them here. We can continue to divert them from the criminal justice system, get them that advanced help that they need, and hopefully make our community safer. So a big thank you to our county commissioners, our local elected officials that have helped make this project come to fruition. It's an exciting day for law enforcement and the community. So with that, I'm going to turn it over to Nancy Isserlis from Pioneer Human Services.
Thank you. Good morning, everyone. I am Nancy Isserlis. I am a member of the Board of Directors for Pioneer Human Services, which is going to operate this facility. And I want to follow on with what Councilman Begg said, and I will call this an elegant solution. It's a solution and it's really elegant. I'm so proud of this community for coming together on this. Pioneer Human Services is a statewide organization. It spends about a quarter of its annual $100 million budget in Spokane County. I bet you all didn't know that. This facility will put Pioneer Human Services way over the top of that percentage point, and it will be the largest facility in Spokane that Pioneer operates. Spokane Mental Health Crisis Program aligns perfectly with the Pioneer mission to help people involved in the criminal justice system to have the support they need to lead healthy and productive lives. This program will provide a one-stop, full-range mental health and substance abuse services for people in the middle of a health or substance abuse-related crisis. Often when someone is in this kind of crisis, they may get shuffled between jail, as you've heard, the hospital, and or a mental health program. The constant change and disruption that causes exacerbates the crisis that they are in and the cost of services to the community. I heard it was 46 beds. It's 45 or 46 beds. Dan Sigler tells me it's 46. Will make a huge difference in our community to respond to these people who need services. It's a tribute to the problem-solving nature of our community to have so many partners come together to make this an investment in Spokane and to allow the people who need these services to have a humane and compassionate way back. So on behalf of the wonderful staff at Pioneer Human Services, its board of directors, its executive director Karen Lee, who couldn't be here this morning, I wish you all the best and much aloha.
Back to you.
I want to thank all of our speakers for being here this morning and thank all of you for being here as well. This is the latest of a series of efforts that the county, in partnership with our other jurisdictions in the community, have instituted to try and keep our citizens safe. You know, when we talk about criminal justice reform, it's not only reforms in the court, but it's in reforms that start with our police officer that meets that individual on the street, and then directing that individual to the appropriate services necessary to change patterns of conduct, and in this situation to provide services for those suffering with mental health or substance abuse addiction. This is not the last improvement we're going to make, it's just the next improvement we make. We're also talking about changing our booking system and a number of other elements in the system to try and make it equal, equitable, and quicker for those that engage in the system. So, you know, this is a win on several levels. Not only does it improve the efficiency of the system, it improves the cost, lowers the cost of the service, but it also helps make our community safer in a compassionate way, which I think all of us would like to aspire to. Folks that enter into this system are still community members, they're still our neighbors. We want to treat them in a compassionate fashion and help them get back on their feet and back into the community. So with that, thank you everybody for being here. We are now going to throw some dirt and start the process of building a building that's already behind us. But it's actually about starting the remodeling of this facility. It's total project cost on this is about $9.1 million. And there are a lot of people that contributed to making that possible, from the state to our partners with the city and others in the community. So thank you everybody, and let's go grab a shovel.
On 3, 1, 2, 3.